Hey guys, thanks for joining me again for another episode of my YouTube channel, Long Live the Brains. Today I'm going to dovetail a little bit off of last week's video, which was entitled The Plastic Brain. Now this was essentially talking about the brain's plasticity, or ability to mold and change itself in an adaptive way. Now it's not necessarily because the brain is forming new cells, but rather the cells that still exist are able to form new connections. This can enable an individual to regain a function that was lost, perhaps as a result of a disease like a stroke, or even learn new things, such as improving your tennis serve or memorizing a quote from Shakespeare. Now, this is really important for our ability to adapt and adjust to the world around us. And we know from many studies that there are lots of factors that seem to be present at increased levels associated with plasticity. Now, I mentioned a couple of these in the last video. One is BDNF, or brain-derived neurotrophic factor, and another one is GDNF, or glial-derived neurotrophic factor. The names aren't so important, but just the fact that there are chemicals that are present that are associated with increased plasticity is an important point, which brings me to the topic of this lecture, which is the effect of exercise on Parkinson's disease. Now, this is in response to a question that was made on video 40 about Parkinson's disease. That person asked if there's any evidence behind exercise and slowing the progression of Parkinson's disease or affecting the disease itself. And honestly, the literature is sparse, but there are a few important things that I'd like to point out. With the punchline, I'll go on and tell you, the punchline is you should exercise. Okay, so what's the evidence to back that up? One is that there have been numerous animal studies on animals with that serve as disease models for Parkinson's disease. Now, we use different toxins to induce a state of Parkinsonism, and then we see which kinds of treatments help to alleviate those symptoms. And we found that in rodents that did have this inducible Parkinson's disease from a toxin, that those that were exercised in various ways actually had improvements in their motor symptoms. Now, you can say, well, what does a rat have to do with me? Well, you're right. It is a far cry from adults. However, it is suggestive that exercise serves some sort of a protective role. Now, another thing that they found in these rodents is that those that exercise tended to have higher levels of the BDNF and the GDNF that I mentioned earlier. And again, those are factors that are associated with neuroplasticity. So at least from our rodent studies, we know that exercise is associated with increased levels of BDNF and GDNF, which are associated with increased plasticity in animal models of Parkinson's disease. Okay, so that's one piece of the puzzle. Now, we know, and I've mentioned this in previous lectures, that aerobic exercise provides a protective benefit against cardiovascular and cerebrovascular issues like stroke and heart attack. And the official recommendations now, which I've also mentioned previously, are that you should have at least 150 minutes of aerobic exercise per week. So what does that mean? Aerobic exercise is getting that heart rate up into the working range, and that's different depending upon your age. So you can go into Google and type in, your age and what's my working heart rate, and it'll give you the answer there. So spending at least 30 minutes 5 times a week in that working range is really what's going to provide you with the most benefit in terms of prevention and protection against stroke and heart attack. Now, if it's not something that you're already doing, say, I'm hanging out on the couch a lot and, I may walk to the mailbox, then it's not something that you can just automatically start doing tomorrow. You've got to condition yourself. But I would say that 5 days a week, 30 minutes a day should be the goal. So work your way up to it. Now, I also want to mention that in lectures 35 and 36, I talked a little bit about sleep and the effect of good sleep on cognition. And there's a slide in lecture 35 that showed that those people that had improved sleep quality had enlarged hippocampi and did better on cognitive function test. There was also another study that I didn't mention on that slide about exercise, and they essentially did kind of the same study design. They took two groups of people. They had some people do some just sort of basic stretching exercises for a period of time, and then others they did vigorous aerobic exercise. And then after several months to a year, they looked at the size of their hippocampi, which are important for memory. They looked at a few other brain regions, and then they found that those brain regions had enlarged in the exercise group. Moreover, they found that the exercise group performed better on cognitive testing. So all of these things seem to be building a fairly convincing argument that exercise is beneficial. It's beneficial for cognition. It seems to be beneficial in animal models of induced Parkinson's disease. And we know that it decreases our risk of stroke and heart attack. So altogether, I think there's a pretty compelling evidence, a pretty compelling argument to be exercising.